Thank you. All right, so thank you to NC Breathe, and in particular to June for inviting me to come and talk. June gave me pretty broad license in terms of what I wanted to discuss. I guess it was keeping it within the realm of economics and air. So I decided to title my talk, How Do We Measure the Benefit of Improving Air Quality, and in particular to use that as a lead-in to a discussion of cost-benefit analysis, which I would view as one of the key ways in which economic theory and practice in particular can influence environmental policy. And recognizing that there's a lot of people in the room who aren't economists, and I know that this kind of work in this field can very quickly get down into the weeds and into the economics and areas that people don't necessarily know about. I'm going to try to keep this talk fairly general and fairly accessible, but I encourage you to ask questions at the end if there's any confusion based on what I've talked about. So cost-benefit plays a really important role in regulatory policy. The basic idea of cost-benefit is that we're going to monetize all of the benefits from a rule or a regulation, making them easy to compare to the costs, which are typically already in dollars. This allows for more of an apples-to-apples comparison between lots of different kinds of benefits, and I'll go through what some of the kinds of benefits that we add up are in a few minutes. And then in principle, we can use this for multiple purposes. We can ask simply, are the benefits big enough to offset the costs? Could the losers from the policies be compensated by the winners? Which, based on actually several regulatory executive orders going back into the 1980s and 1990s, that's actually required now of all big regulations at the federal level. But we can also use cost-benefit simply to rank policies by how good they are. If we have a limited budget for implementing policy, we can go for the policies with the biggest bang for the buck first. So there's multiple ways in which we can use this. Okay, so many of the most important environmental regulations in US regulatory history have had really big improvements that we might like to value. Okay, so I'd like to spend just a couple of slides showing you what some of those are. This is where it gets out of the realm of the economist and more into the realm of the medical professional and the environmental health person. So I don't try to claim to be too much of an expert here. I'm more of a consumer of the medical research myself. But when we talk about the Clean Air Act, we've seen massive reductions, okay, in lots of criteria pollutants and acid rain more generally. That extends over to not just criteria pollutants, but air toxics. If we go back over the last 20 or so years, big reductions across the board. These have had big impacts on a variety of human activities, most importantly, I think, on the health side. And I'm actually not going to say a lot in my organized comments about how economists value mortality and health, because I thought I'd probably run out of time. But I added a few slides at the end of my talk after the conclusion that I won't go to, but I am happy to get into that in the question and answer period afterwards. Because you'll see that a lot of the benefits that come from, for instance, the Clean Air Act amendments of 1990 come in the form of reduced mortality. So this is an estimate, it's a calculation of the benefits in the year 2010. We see hundreds of thousands of avoided deaths from particulate matter alone. We see millions of avoided cases of asthma, lost school days, lost work days, okay, all things that add up to have very big dollar figures attached to them. And the numbers get even bigger if we look out in projections to 2020. This actually has led, these improvements have been so big that they've actually affected our life expectancy. So roughly a half a year or more increase in life expectancy based solely on the improvements we've seen between 1980 and 2000. Now, not all the benefits that we talk about when we discuss Clean Air Act and other big regulations are health-based. There's a variety of ecosystem improvements that we've seen. Forest health was a big one. This goes largely back to the sulfur rules passed in the early 1990s and timber yields. but improved visibility, national parks is a big area we look at, but urban haze and just a variety of environmental amenities aside from health. So adding up these diverse improvements, lots of different areas in which we need to calculate benefits, has led to a very big total estimated benefit. And for the Clean Air Act amendments of 1990, the estimated ratio of benefits to costs is roughly 30 to 1. So that circle there, the darker circle relative to the small circle, is your visual representation of 30 to 1. But the actual benefits, $2 trillion, these are big numbers and very clearly pass cost-benefit analysis. With regulations coming down the pike, the MATS rules, mercury and air toxics, the projected benefits there are large as well. So this is sort of an annual measure here of what we'd expect in terms of avoided premature deaths, asthma attacks, sick days, things like that. And there the value that we are estimating tends to be in the many billions of dollars. So maybe not as big as the Clean Air Act amendments, but this is a more targeted rule, and we're still talking about big numbers. Aside from just adding up the benefits of regulations to compare to their costs, there's lots of other reasons why we might want to know how valuable these cleaning up different kinds of pollutants are. For one thing, there's a lot of discussion now about natural gas possibly replacing coal. And if you compare the emissions that you get from a variety of different pollutants in both coal and gas, and oil is thrown in there in the middle, you see really large reductions. Okay? So the reason that we need to think about how big the benefits of these reductions would be is because cleaning up coal by switching to gas is not a free endeavor. We're talking oftentimes about scrapping coal plants that still have productive life. Okay? But given the size of the reductions, that may very well be something that would be a reasonable thing to do. I do throw these things. I do a lot of work myself on shale gas, and a lot of the problems we look at when we talk about shale gas are actually water-based and concerns about water contamination. So when we're talking about going back and forth between coal and gas, I want to just throw in there that we might be replacing an air quality problem with a water quality problem, something else to keep in mind. But there are alternatives that don't have those water quality issues, for instance, renewables. The problem is that many of the renewables we might want to go to, like solar, produce electricity at a higher cost than coal does. And that might not be a problem, right? Solar is about as clean of an energy source as we can get. And if we eliminate those emissions, the benefits that we get from the value of those those health improvements might be more than enough to offset this additional cost, making for a social improvement, right? In principle, the winners, the breathers, could compensate the losers who might be utility ratepayers, but in essence, that's all of us usually in one role or the other, okay? So there are a lot of reasons to think cost-benefit could be useful, reasons to think it might be good. But when I teach this, I like to point out the fact that it's okay to be skeptical about it. And a few of the bigger picture reasons why we might be skeptical are some people just object to the idea that we can put dollar values on the environment, on environmental amenities, on ecosystems, and more importantly, maybe on human life. Okay? So this was a book by Lisa Heinzerling and Frank Ackerman. Lisa was the assistant administrator of the Office of Policy at the EPA under the Obama administration. So at a very high level, there was questioning about whether this was actually something that could be done, okay, whether this was a valid effort or not. We also see some argument elsewhere in the literature, not usually in economics, but more sort of in ecological economics as opposed to environmental economics, discussion about whether an anthropocentric view of the world is actually correct. Okay, when we do cost benefit, and I'm going to talk you through some of the methods we use, this is where we'll really get into the economics, you're going to see that the values we derive are the values based on usefulness to humans, okay? And there is an argument to be made that that's not a valid exercise, that things have intrinsic rights. So this book by Callcott is one of my more favorite intrinsic rights books to read. The argument I would make against it is that if everything has an intrinsic right to exist, it makes it really hard to decide between policies that are all going to do something damaging to the environment. You want to pick which one to engage in. You need some metric. So everything can't be equally valuable. Okay, so what I'd like to spend a few minutes now talking about, the majority of the rest of my time, is the fact that when we do cost-benefit analysis, in particular when we value the benefits attached to environmental goods and air quality in particular, we make many assumptions. We make choices about methodology, okay? And those choices can have big impacts on how big the benefits we measure are. And when I talk about big differences, I'm talking about orders of magnitude and 2, 3, 4, 5 times bigger estimates based on methodological innovation, okay? And these are some papers that I've worked on, and I'm going to pull out some papers from colleagues at other universities, papers that I think make the case really clearly that these kinds of assumptions can matter, okay? So we're really going to get down into the sausage-making process now and the details on how this actually works, okay? So hopefully you stay with me and don't get, yeah. So the first big question here is going to be, what is value, right? That's a pretty deep question, and when economists talk about it, I'm afraid they don't usually treat it as deeply as you might like them to. When economists talk about value, they're usually talking about willingness to pay, okay? So the definition of willingness to pay, or a simple definition, is there in the middle of the slide. It is what one is willing to give up in other consumption, so we don't even bother specifying specifically what that other consumption is, but other stuff in order to get one more unit of the good in question, and that good is, you know, probably something like cleaner air, okay, so one less unit of particulate matter, holding utility or happiness fixed, okay? And I won't go into a lot more microeconomic theory to justify that, other than to just say, when you go to the grocery store and you buy an apple, and say they're $1.65 a pound, the microeconomic theory is going to tell us that's your willingness to pay. That's what you're willing to sacrifice on the margin for that last apple you purchased in terms of other things you could have bought, all right? The problem is going to arise for things like clean air, that there is no market price. You can't go down to the grocery store and pick up a unit of pollution-free air, okay? The reason for that, and this is sort of getting into public finance theory, is that clean air and lots of other environmental goods exhibit characteristics of public goods. And the two key characteristics are any good that's both non-excludable, okay, which means that you can consume it basically without paying for it. So if we're going to set a price and force people to pay in for cleaner air, it's going to be really hard to stop someone from breathing if they refuse to pay. Okay? And on the other side, it's non-rivalrous, which means in general we don't want to keep people from consuming it because your consumption of clean air doesn't really stop my consumption of clean air. Right? We'd have to be a pretty congested room for the air to actually become scarce. All right? So in general, in situations like this, the market can't sustain a price. All right? When the market can't sustain a price, we have a public good and we need to go to alternative mechanisms to back out prices. And this is where we get into the field of non-market valuation, subfield of environmental economics, and this is where I personally spend most of my research time. So I'm going to walk you through a couple of different mechanisms, techniques that we use in environmental economics and non-market valuation to come up with values for things without prices. Okay, so a really convenient way to look at the value of air and lots of other amenities that are spatially defined is by looking at housing markets. And when we do that, we use a technique that's been around since really the 1930s, but really took off after the 1970s, known as hedonics, hedonic analysis. The idea here is that you look at a related market where there are prices, where the good you're interested in is an attribute of the thing that has a price. Okay? So houses, when you buy a house, the local environment, noise, etc., these things are all part and parcel of the house you're purchasing. You get them along with the house, and they're hard to avoid. Okay? We talk about compensating differentials, which basically say if I had two identical houses, but one is slightly more polluted, how much am I willing to pay additionally for the house with slightly less pollution? If the two houses are identical, that compensating differential is going to tell me how much the cleaner air part was worth. Okay? So here's two pretty extreme examples, right, of houses that might have different prices, partly because of the air quality surrounding them. Okay, these all come off of the common source of pictures, so they come from different parts of the world. I don't want to claim these are all right around the corner. But the idea here is relatively simple, but the practice is actually really difficult. Okay, and that's what a lot of what I want to show you is how you do this in practice and the problems that might arise. So the simplest problem that's going to come up is the fact that there's a lot of other things about houses besides the air quality that people think about. And as a person who's bought several houses, as I imagine most of us have dealt with the real estate market, air quality is important, probably more important to those of us in this room than a lot of people, but you think about other things probably first, like school quality and crime rates, maybe before you get to the air quality part, right? It's probably somewhere shortly down that list. And then there's even issues, things like curb appeal, just the fact that some houses look nicer than others, right? And these are things that are really hard to see in data. We don't have a good variable in most data sets for curb appeal. So how are we actually going to prevent these things from confounding our estimates? If all the houses in dirty neighborhoods have bad curb appeal, the curb appeal part's going to get lumped on top in a statistical analysis, and we're going to misestimate the value of cleaning up clean air, or getting more clean air. The biggest problem that tends to arise is one that tends to make, in virtually all economic analyses, the value of clean air look too low. Okay? And that's the fact that dirty air is frequently associated with economic activity, jobs, business. Okay? And people tend to like economic activity. House prices are higher in cities where there's a lot going on, despite the fact that the air quality there is worse. Okay? And you need something that's going to take that effect out, or what a lot of studies found in the 1970s and 1980s, before we get into the techniques I'm going to describe, people found values of air quality that were basically zero or negative, okay, if you're not careful. And when I have my students do projects in class, I give them this kind of data. The first regression they run usually produces a negative value for air quality. And then we step back and ask, what's confounding your estimate? Okay? Well, the first thing you can do is simply control for other things. So if you've dealt with statistical analysis, you've seen multivariate regression, basic idea is you want to estimate an equation relating price to air quality, controlling for other stuff. So that's fine if you can see the other things. And here's an example of one of those regressions from a project that I did. It was more of a methodological piece with one of my older students, where we look at ozone in California, in the Bay Area. And here what we see is a relationship between price, that's $400,000, and this is $150,000. Prices in the Bay Area are just generally pretty high. The difference with number of days of ozone exceedance. Okay, and you can see the direction goes in the direction you would expect, where houses with more pollution are cheaper. To get that result, you have to control for a lot of other things. I don't show you the full regression. Okay? But, actually, what time do I have until?
You got time.
Okay. Because now what I'd like to do is show you the way we try to do this better. And this is where it could get really confusing, but I'm hoping it won't. I'm hoping that the discussion will stay high enough up that people don't get sort of lost in the process here. But I'd like to show you some refinements to how this sort of thing works. Okay, this is the way people have been doing this for the last 15 years or so, not back in the olden days of non-market valuation. And what I'd like to emphasize is just how different the results are when you do things to improve upon the method. Okay? So I have 3 examples that I'll show you, and then I'd like to stop, before I finish, actually spend a minute talking about equity, and I'll get into that. You'll see how that fits in at the end. Okay, so the first approach, and now this is sort of standard practice when consulting firms are hired by the EPA to evaluate a rule. They'll frequently do what we call a difference in differences analysis. Okay? What's nice about difference in differences is that it tends to, for the medical people in the room, it tries to emulate the sort of variation that you get when you run a randomized control with treatment and control groups, a randomized control trial. Okay? That's a hard thing to do in a pollution setting because we don't get to go out and pick houses and randomize and say you're going to get pollution dumped on you and you're not. Right? That's just not in the cards. But what we do try to do is pick a group of houses that we think over time are going to behave like the houses that are getting treated by either an increase or a decrease in pollution. And that control group is going to tell us what the treatment group would have looked like had it not been treated. Same idea that you'd use in a medical study. Okay? So here's a picture of what may happen if this is as detailed as it's going to get, I promise. A picture of what would happen if we saw a house treated with increased pollution. What we're really trying to recover is this effect right here. How much did house prices drop as a result of pollution going up? Okay? But what we might see is that in addition to that pollution increase, there might have been a secular trend downward in house prices over time. Okay? So how do we control for that secular trend, the thing that's dragging house prices down that has nothing to do with the pollution treatment? Well, one way to do it would be to find a control group that has a similar secular trend. Then what we do is we look at a time before the pollution changed and a time after. I've got them labeled as T0 and T1. Okay? We quantify the change in price in the treatment group over that period. All right? And somewhere in that change in price is the thing we're really interested in, which is the discrete drop. Then we do the same thing with the control group up here. And then so those are two differences, and then we take the difference in those two differences. And I didn't want to put up another graph, but if you stare at it long enough, the difference between that change and that change is going to be that discrete jump right there. If the control group is actually behaving the exact same way the treatment group would have behaved. All right? So there's assumptions behind this, but if you can get a really good treatment group, everything's great. So a lot of what economists spend their time doing is justifying the choice of the treatment group. So just to give you an example of a paper, a fairly famous paper in economics that used this method, it's actually a little older now. This paper is from back in 2004. Lucas Davis, who's at UC Berkeley, looked at a cancer cluster, a big increase in pediatric leukemia in Churchill, Nevada. That's this county right there. That appeared in the late 1990s, early 2000s, and wanted to know what was that worth to people. How do we value a big increase in cancer? So what he did was he chose a control group, namely the county right next door, Lyon County, and he justified the use of Lyon County by showing that both Churchill and Lyon County actually had price paths that looked pretty much just like the rest of Nevada up until the time when the cancer cluster was discovered, at which point Churchill County kind of broke off and house prices there stopped rising. Now the problem would be if we just looked at the change in Churchill County, here's a table summarizing his results, you would see that house prices over time, these are log means, or the means of the log prices. So that's a percent change in house prices, roughly 3.7% drop in house prices in Churchill. But if you look at what they would have done had they behaved like Lyon County, where prices went up by 4%, you get a 7.7% drop relative to what you would have gotten in Lyon as opposed to a 3.7% drop. That has a big effect. It's more than doubling the impact, right, our willingness to pay to avoid this pediatric leukemia cluster. So that's going to have a big effect on cost-benefit analysis. Now you have to worry about things. I don't have it on the slide, but what would happen, for instance, if people started vacating Churchill County and moving over to Lyon County when the pediatric cancer cluster popped up? House prices in Lyon would go up while house prices in Churchill are dropping, and that's a problem. That's actually a contamination of your control group by your treatment group. And if you're in medical studies and work in that realm, you'd know that that's a bad thing. Okay, second idea. This one is, I draw this from a fairly famous paper on air quality and environmental economics by Michael Greenstone and Ken Che, okay, where what they looked at was changes in median county house prices, house values in the census, between 1970 and 1980 to measure the impacts of the Clean Air Act. This is one of the first papers to evaluate the value of Clean Air Act improvements in big particulates relative to what we were talking about before, total suspended particulates. But that's what they measured back then. Now the problem was the one I mentioned earlier, that basically counties with improving air quality might have actually been counties that had declining economies. shutting down factories is a really good way to improve air quality. It's not necessarily a policy we want to adopt, but it's something we have to worry about. Okay? So what they do, and what you see a lot of economists doing in these kinds of papers, is exploiting discontinuities in rules. That's an important way to get identification. So in this particular paper, what they do is using the Clean Air Act, there's a cutoff where a county gets assigned a non-attainment status. And if you're in non-attainment, your county gets stricter regulation, and that strict regulation makes air quality improve. Okay? So what we want to find is an exogenous source of air quality improvement, namely one that's not correlated with things we can't see, possibly like economic activity that we can try to control for that, but we might have a good variable for it. So the two rules they used are that you only get put into non-attainment if your average annual TSP level is above 75 micrograms per meter cubed. Okay? Or, alternatively, you could be below that, but you had a bad day. It's the bad day rule they talk about here, where your second highest daily concentration over the course of the year was over 260 micrograms per meter cubed. Okay? So keeping those two rules in mind, they create what we call regression discontinuity subsamples. Okay? The first one is they only look at counties that had an annual average concentration that was either 50 parts per million above or below the 75 cutoff. Okay? The alternative is to look at counties that were all below the cutoff. So in principle, none of them should have had a bad, or should have been in non-attainment, but some of them were because they had a bad day. All right? So the idea here is going to be that we're looking at counties that are generally more similar than comparing a county on the upper end of the TSP range to the lower end, right? But some of them got treated and some of them didn't. So the treatment is going to be less correlated with things about them that we can't see. This is just a picture from their paper. If anybody has a question later about their method, I might pull that picture up. But this is their result, and this is just to show you how much this can matter. If you do a cross-sectional comparison, just looking over counties in 1970, places with high and low TSP, and do the same thing in 1980, you basically get a zero effect on house prices. So you'd come away from this thinking the Clean Air Act basically had no value. That would have been the original conclusion. If you look at the regression discontinuity based on the 50 above or below the 75 cutoff, a 1 microgram per meter cubed reduction in TSP is actually, people are willing to give up 0.45% of their house value. So less than 1%, but it's not that big of a change we're talking about. But if you compare that difference to what's essentially statistically zero, this is a big deal for measuring benefits relative to costs. The bad day rule had a slightly smaller effect, but we're still talking about orders of magnitude bigger impacts, right? By using these sort of refinements to simple hedonic analysis. All right, the third and final refinement that I'll talk about is this idea of instrumental variables. So this is something that you'll pick up in an undergraduate econometrics class, but you won't see it much before that. But the idea of it, I think, is pretty simple, okay? This is from a paper that I wrote with Pat Bayer and Nat Cohane. Nat Cohane's now at Environmental Defense, but all three of us were back at Yale as assistant professors when we worked on this. The idea was to value improvements in PM10 over the course of the 1990s, all right? Where we're going to recognize the same problem I just talked about. In particular, communities that were booming, may have had a lot of activity, are probably also experiencing increases in pollution, and that's going to make it look like pollution is good, okay? Rather than use the sort of regression discontinuity approach that we just saw, we're going to use an alternative source of variation in pollution, okay? We're going to isolate a source of variation in pollution that we're going to argue is uncorrelated with anything happening within the community of interest, okay? That's the idea behind instrumental variables. That's the terminology, okay? We're going to do that using what is called a source receptor matrix. It's basically a county-to-county matrix of the flow of any kind of pollutant. In particular, here it was for PM10, that the EPA put together to monitor, or to predict, I guess, how much pollution was coming from various sized smokestacks in one county and landing in another county. So a very big matrix for the whole US. And I'm just going to summarize that exercise with a map we drew for Raleigh-Durham there. We did this using cities, MSAs. That's the Raleigh-Durham MSA. We take out all of the pollution sources within 100 kilometers around Raleigh-Durham because we'd argue they might be correlated with the economic activity going on there, and we focus on what's blowing in from the outside. So you can see where we're sitting here in Charlotte. It's actually a big contributor to the air quality problems in Raleigh-Durham. But interestingly, one of the biggest contributors is actually a power plant out in western Tennessee that tends to, all its pollution blows across and gets deposited over here. And then you see there's a lot of smaller, basically yellow is worse and red is the worst overall. So that's going to give us a source of pollution that we're going to argue has nothing to do with the economic activity going on at that time in Raleigh-Durham. Now this is what you get when you do a simple statistical analysis like the regression equation I showed you a while ago, and then you use this alternative source of variation. It's not as drastic as what you got using the regression discontinuity approach, because we actually have some other controls we use in the simple regression, but it more than triples the value of the cleanup. Okay? This is measured in terms of the percent of income that a household's willing to give up for a small reduction in particulate matter. Okay? So again, a tripling, these are big differences, things that would have orders of magnitude impacts on cost-benefit analysis. All right, so I have one last point to make, a couple of slides to make it, and that's that I'd like to point out that cost-benefit analysis is really only tackling half of the story. Okay? And this is a question, a broader question that I've gotten into myself a lot in the last couple of years. In particular, the question of equity. Okay? So when we talk about cost-benefit, we talk about benefits being big enough so that everybody could be compensated. Generally, we never actually ask if people are compensated. Okay? We're just trying to make the pie as big as it can be by doing policies that have big net benefit improvements, and then we sort of leave it to the political system or the economy in general to just figure out who wins and who loses, and hopefully the same people don't lose every time. Okay? But in reality, the same people do tend to lose most of the time. And that's where this question about equity, which is just a fancy word for fairness, starts to come in. And in particular, which groups are being disadvantaged. And this is what's formally now been codified as the notion of environmental justice. And the formal codification of this came back in 1994 when Bill Clinton signed an executive order basically requiring that all federal rules look to see if they're disproportionately affecting, so the disproportionate or adverse human health impacts on minority or low-income populations. Okay? So something that cost-benefit completely ignores. It's really easy, I think, to illustrate that this is a problem. So what I'm going to show you here is a couple of maps that come from a paper that we did looking at the causes of environmental inequality in Los Angeles. In particular, we use data from the National Air Toxics Assessment, which is a very finely measured data set that tells you roughly how much more likely you are to get cancer or to have respiratory or neurological problems than somebody living in an average situation. That's relative to the average. That's the basic idea. So what I have here is the distribution of white population in Los Angeles. Okay, this is Los Angeles County, relative to the native cancer risk. All right? And I don't think we need to probably go into too much detail in order to say that there's a correlation there. I'll actually show you the mathematical correlation in a second, but I think the maps are more illustrative. You can see that the light area over here is the dark area over here. And instead, if you look at Hispanics, who are the largest group in LA, it gets more difficult if you want to look at African Americans and Asians because they're far more clustered in small areas within LA. The Hispanic population is very spread out, but because it's spread out, we know that they're sorting to neighborhoods that they want to live in, and what we can see is they're living in far more polluted neighborhoods. So why is it that this kind of correlation arises? So if you actually look at it just from a pure numerical point of view, the correlation between native risk and Hispanic population is close to 40%. For whites, it tends to be the opposite, close to minus 45%. Okay? And for blacks and for Asians, it tends to be in the middle. It's a lot harder to pin down trends there. Okay, so why is it that we see this sort of thing arise? Okay, this is what's relevant if you're Bill Clinton writing this executive order and you're the EPA trying to follow it. We need to fix this problem, so why does it arise? I'd argue there's two main concerns. One is that pollution sources might be getting dumped in minority and low-income neighborhoods. That's the siting problem we talked about. The alternative is what we'll talk about as sorting, just the fact that for one reason or another, poor individuals might choose to move into more polluted neighborhoods. Okay? That doesn't have to mean that they don't mind pollution. It doesn't have to mean that they like pollution. What it does mean is that these groups are typically poor, and if you're poor, the value of another dollar, if you can save it on a house purchase, is worth a lot to you in terms of being able to buy things like food and medicine, other necessities of life. More so than if you're not so budget constrained. Okay? So detecting which of these factors is behind that sort of correlation is really important, because if it's siting, we need to fix zoning rules. If it's sorting, which is what I would actually argue based on the paper, the work we did in this paper that I just showed you the maps from, the problem is a lot more difficult. We actually need to fix income inequality. You can go around and you can rezone neighborhoods, but after 10 or 15 years, people are going to make decisions in their economic interest, and if they're poor, they might decide to move there. You're going to be back in the same situation again. Okay? So I'd like to throw that in at the end just to point out that the cost-benefit framework still has holes in it, things that people are really actively working on. Okay? These methodologies and fixing these sorts of equity issues are the topics of dissertations that I'm overseeing right now at Duke. So this is cutting-edge stuff. The grad students working on these are doing very new work in these areas. But that's really all I've got to say. And I think what I'll do is just leave my conclusions up there and take questions. I did mention I've got a few slides about how economists treat mortality. I wasn't sure if I'd really have time, but I think it'd probably be better maybe to take questions. And if anybody's got a question about that, I could talk about it.
Why don't you go ahead and do that, and then we'll take your questions.
Yeah.
Oh, yeah.
Okay. Well, so let me just put up one slide, and then I'll show you one table. Okay? Because I'm not exactly sure how well it's understood when economists put dollar figures on deaths, how they go about doing it. And in particular, it's a very important exercise because most of the value of something like the Clean Air Act actually comes from avoided death. So the dollar figure you attach to one avoided death, if that's half the size of what it currently is, somewhere in the neighborhood of $7 million, you could easily make a policy not worth doing. Or if you double that number, you could make the policy very clearly worth doing. And it's a dicey statistical exercise for reasons that we can talk about. But basically, the idea is you can't go out and ask somebody what they'd be willing to pay you to not be killed. Right? Economists are not that oblivious. We know no one's going to give you a good answer to that question. So what we would do is ask you, how much would you be willing to pay for a really small reduction in your risk of being killed? You'll probably tell me that, right? We go through those kinds of decisions every day. We speed in traffic to get to work on time, which has a monetary benefit to us if you're punching a clock, but that speeding raised your risk of death that morning a little bit. Okay, and people make that kind of trade-off all the time. So then what we do is we measure your willingness to make those kinds of trade-offs, usually using data on hedonic methods and data from different jobs. So if you work in a job where your risk of being killed is higher, how much more do you get paid for that, right? That gets difficult because you see a lot of people working in white-collar jobs where the risk of death is really low, right? But they get paid a lot more than people working in blue-collar jobs. So a standard result you find when you do this sort of thing is negative values on life, okay, until you get careful about it. Once you've gotten careful about it and you estimate that compensating differential for risk, you then simply multiply that little bit of risk up to a 100% probability of death. And that's what economists call a statistical life. That's the difference between life and statistical life. And what we're valuing is statistical life. Okay? And every one of those calculations about the value of the Clean Air Act that has to do with avoided deaths from particulate matter and things like that is coming from averages of lots of studies that do basically what I just described. All right? Lots of problems with that. One would be getting killed by falling off a ladder at work is a very different way to go than dying from cancer over the course of many months, right? One is very painful and one is sort of, it's over before you realize it. We might actually be willing to pay more to avoid dying in a slow, painful way than to fall off the ladder at work, okay? There's also problems with the people who choose to go into risky professions might be people who don't mind risk so much, right? And those are people for whom, you know, death isn't so, or maybe they're risk takers, they're not going to demand a big compensating differential. That can value down the value we put on a life. The paper that I'm going to show you the table from is actually one where we focus on the fact that people go into jobs that they're good at, right? Which seems like something pretty obvious, but the idea behind a standard hedonic regression basically says if I picked myself up as an economist and set me down in a job as an environmental health professional, as a doctor, if we have roughly the same education, which in the data set would probably be a Ph.D. of some sort, I would get paid the same thing that you're getting paid for all the environmental health professionals in the room, right? Which is probably not a very good assumption because you chose that route because you liked it or you were good at it. I chose the economics route for the same reason. And there's something about us that's idiosyncratic that's going to drive the outcome in terms of our wages. So that's a hard thing to fix, and it would take another hour for me to explain how we fixed it. But I have one example here. So if you pick up an office worker and make him a rodeo clown, are we going to end up seeing him earn the same amount? Or did the rodeo clown actually go into that because he was particularly good at working with horses and bulls, whereas my office worker over here, not so much, right? You fix that using lots of fancy statistics, and this is actually what we got. Using the standard wage hedonic story, based on the sort of thing I've been talking about up until now, you get a number, using a really good data set actually on what people earned, of about $2 to $3 million for a statistical life, which is actually on the low end of what the EPA, for instance, uses. That's for prime-aged males working full-time. It gets really difficult when you look at women's labor market experiences. And this is not an uncommon result to get in wage hedonics. It's actually just a negative number. Because there's a lot of women who have higher reservation wages, they're working more part-time jobs, people leaving the labor force when they have kids, things like that. You fix the idiosyncratic problem, the fact that people do jobs they're good at, and we actually get numbers for both groups that are roughly $11 to $12 million, which in VSL world is a really big number, okay? There are numbers out there of $20 million, but they're fairly few and far in between. We had a hard time publishing this result in a mainstream general interest journal because the referees we got looked at that result and said, that's just too big. We don't know why, it's just too big. But we were successful with it eventually, and it's now out there, published. But I would argue, it's kind of a theme in everything I'm showing you. Most of the numbers you get, if you're not careful, for the value of life, the value of clean air, a lot of them are too small. I'll leave it at that.
And I'm sure Chris takes some questions, and here's the first.
Great, that was a terrific talk. Thank you very much. Just because of the audience here, just to clarify one thing. In terms of the Clean Air Act in the setting of the National Ambient Air Quality Standard, just the setting.
Yes.
Economic cost benefits not included, assuming that they don't consider political forces. But everything else, the cost benefit from implementation certainly.
Right, whether the rule is actually going to get passed, whether it's going to get past the RIA and it's going to become a rule or not.
Right, so I guess my question for you then, and it's, you know, I don't know how it gets embedded in everything you were talking about. You know, you have some terms like willingness to pay and things like that. They're all sort of passive terms. And now that the air is clean, most people don't pay attention to it. How do we translate these impacts which you have here, which can be substantial, whether
Yeah.
it's personal life, where you buy a house, all that sort of thing, how do you translate that to the public at large, realizing that's a huge expanse?
Yeah.
So that the public can use that both in terms of decision-making actively as well as pushing forward the agenda, which we're talking about today.
Well, so I would argue that while the air is a lot cleaner now than it used to be, we're deriving big numbers of revealed preference. So people revealed these preferences in the housing market in the 1970s, and then even more recently in the 1990s we find big numbers in their house purchase decisions. So people do actually still care a lot about it. The margins on which they're making the decisions tend to be a lot smaller than if we were doing this in Beijing or something, right, where the difference might be really large in which city in China you want to live in, for instance. But I think people do still care quite a bit.
Well, I think they care, but
Yeah.
do they know that they care?
Well, see, that's the thing. This is what economists love to do, is that we assume you know what you're doing, even if you don't, because you're just really good at the process of life and buying a house and getting a job, and these are things people are good at, so they're making these decisions even if it's subconsciously. The trick is, and oftentimes I'll give talks to very non-environmental audiences, and they'll tell me, I woke up this morning and I have no idea what my air quality is, and I bought a house with no clue. How can you tell me that you can actually measure this from house purchase decisions? The one thing I will say is that we go through epic amounts of effort to rule out anything else that could be correlated with the air quality part. And the air quality part always still shows up as being big and significant. Right? I gave you 3 examples of ways to control for those unobservable things, and there's dozens of other papers out there that try alternatives. Air quality always matters. So you'd have to come up with something that's correlated with it that we don't know about in our data set that all of these techniques aren't fixing. So I think people really, really do care, and I think at some level they probably know they care. They just might not always think about it actively. So how do we use the numbers? You know, we publish them and we give them to EPA when I'm doing projects for EPA, and I hope that they work their way into the system. I think the most direct mechanism is just to get rules passed that will fix things. That's very much outside the public, though, right?
Right, and I guess that's what I'm asking is how do we put this in the public's hand with more and more?
Yeah, it's an interesting question, right? Because at some level the public is giving us the information in the first place, and we're refining it and pulling things out, and now we can turn it back to them and say, look, this is what you actually think in the way that you're behaving. So when you go to vote, maybe you should actually reflect those preferences too, because it clearly matters to you when you buy a house. Yeah.
All right.
So is there an age-related factor for the statistical value of life? Because,
Yeah.
you know, somebody who's starting off at 20 or 30 years old has a certain value, and I'm not implying elderly people don't have as much value as young people, but it's the elderly who
Right.
tend to die more readily from the air pollution. So how does that factor?
Yeah, so the EPA actually, at one point about 15 years ago, did try to imply that the value of elderly people was lower. A friend of mine, Joe Aldi, and a co-author too, did a study that seems really sensible, where they valued willingness to pay to avoid death in these small little micro measures of risk. And they found that, yeah, old people are willing to pay less to avoid risk of dying, because you could take that money and not use it to avoid dying and go on a nice cruise. And maybe that makes sense because, yeah, you probably are going to die sooner, so the value of putting it off in some expectational sense isn't as great. And that's reflected in the data, okay? But they wrote this paper and they put it out there, and EPA actually considered it for a few weeks, and they ended up with AARP showing up on their doorstep with people wearing hats that had little discount old retirees wearing hats with discount tags. They called it the senior death discount, right? These things tend to get renamed. And they don't go near that anymore. And in general, I'm not a fan of considering different VSLs for different subgroups in general. You will find people who do them for different race groups, for different income groups, things like that. I'm more of I have a belief more than a knowledge But I think once you've controlled, I'm sympathetic to controlling for age. I wouldn't do it myself in a paper because I don't need that kind of hate rolling back on me, but I'm sympathetic to the idea. I'm not sympathetic to sort of breaking it down into other groups. I think once you've controlled for age, there's a single number we should basically apply to the population.
But that brings up the question, and as you're saying, that is because the critics will always say that your cost-benefit analysis is faulty.
Yes.
You have much more benefits than you're really getting.
Right.
Because of the way that you estimate the statistical value of life,
So there is one solution that they've incorporated into the rulemaking where instead of looking at the value of a life, there's another term now called the value of a life year, which is basically broken down to how much are you willing to pay to get one more year of life. We'll estimate a single one of those for the whole population, but when you go to apply it to an 80-year-old, their predicted probability of living for, it's going to apply to fewer additional years. You apply it to a 2-year-old, and it's going to have a big impact. So now you're going to target policy using value of statistical life years more to things that affect infants than that affect the elderly. That's the one way in which I've seen this actually work its way into policy. Saying the old people are just worth less is not a practical way to do it.
Over here.
So relating to the first speaker's question, how much of what you're seeing is driven by the actual value of air quality versus the perception of air quality?
Yeah.
There's no quantifier for perception.
Right. And what we're doing, the short answer is it's entirely perception, and what we'd like to hope is that the perception actually has some correlation with reality. Now, the most interesting thing I've seen to relate to your question is that we've actually spent a lot of time looking at, I actually spend more time nowadays looking at shale gas and effects of shale gas exposure and exposure to drilling on house prices. There what we find is that if you have a groundwater dependent house, this is all work in Pennsylvania, you see roughly when a well pops up within 2 kilometers of your house, you see a drop in house prices on the order of 10 to 15, 20%. If you're on piped water in Pennsylvania, so you're getting water from the city, you see no drop and possibly even a slight increase, which is probably because we're not controlling really well in the Pennsylvania data for leases. So some of these houses are actually getting paid money. So that's probably the increase. But basically no effect if you're on piped water, big effect if you're on groundwater, which would suggest, if you were to sort of break it out, the real cost is coming from people's perceived risk of groundwater contamination. Now this gets somewhat political and somewhat dicey in terms of which evidence do you believe, but in general there's not real good consistent evidence yet of lots of groundwater contamination, particularly from fracking fluid. Methane's a different story, but on the fracking fluid side, there is some evidence, but the debate's still out. So we had to be very careful in that work to say what we're valuing here is the perceived risk of groundwater contamination, right? But if you want to say, does that have an economic impact? It has a huge economic impact. These people lost value to their house because of shale gas operations coming in nearby. That's a fact. That has nothing to do with perceived versus not.
But the economics is tracking the perception, not the actual environmental risk.
Yeah, what we're doing is we're using revealed preferences. People made decisions. So it was what information they made that decision on, which may or may not be right.
Thank you.
Okay.
Yep.
That was a great talk.
Thank you.
You did a great job talking about air quality and some of the fracking stuff. In North Carolina, there's operations of industrial farming and hog farms and so forth.
Yeah.
Have you looked at the economic impact of the housing or the communities around these hog farms?
Yeah, so there's been a couple of studies done. I actually had a senior thesis student 6 years ago work on this question. It's very difficult because the standard data sets that we have to look at housing are not great in rural areas. So to do the fracking in Pennsylvania, we had to get access to a very, very expensive data set that luckily the real estate company gave us access to for free, or we never would have been able to do it. To look at to look at the hog farms in North Carolina, the student actually had to use restricted access census data, which again, hard thing to get into and to look at. There's one other paper on it, and she, by the way, found big effects that didn't surprise any of us once she got the data and looked. on the order of like 10, 15, 20% house price reductions, depending upon how close you are. The best well-known study for this, not a senior thesis, is by Ray Palmquist at NC State, who did this study back around the year 2000, who was able, the tricky thing there was actually getting data on where the hog farms are, which you think would be pretty simple because they're just there, but there were rules passed that made it so that the data on where they were located would not be recorded and passed out. This is our legacy of hog farming. And nowadays, I think the biggest question surrounding industrial farming is actually an environmental justice question, because there's a case now, waterkeepers and a variety of other groups in North Carolina have a case going, Title VI case in operation with EPA, saying that the state government here did not adequately defend the minority and low-income populations in eastern North Carolina in their permitting of new industrial operations. And that's in process now. If it goes through, I think that would actually be the first successful application of Title VI to an environmental justice claim. It's been tried before without success.
Thank you.
I was wondering if you could comment, and this is sort of, you gave a benefit cost analysis for the Clean Air Act amendment.
Yes.
And can you extend that to EPA? Or, and I guess what I'm getting at is, you know, there's a lot of political blowback on EPA that it's job killing, and I don't know that there's really any empirical evidence to support that, and maybe to the contrary, there might be evidence to say that's not the case. I was wondering if you could comment either in terms of the effect on jobs or the distribution of jobs, and how that relates to the benefits and the cost of the regulation.
So EPA actually, about 3 years ago, because they were getting big blowback from Congress about the job question, put together a series of meetings. I think there were 3 of them. I went to 2 of them that were focused on how should we treat jobs in cost-benefit analysis, because they didn't really know what the right answer was. The upshot that came out of this, and I just taught this, I did my jobs lecture in my undergraduate environmental class last week, because I like to take a minute and step aside and say, this is what, you have to be able to say something about jobs. The upshot is that if you're in an economy where it's very slow to get a new job when you lose a job, so not a full employment economy, not a frictionless economy, there are costs to long-term employment. People lose skills, they suffer depression, they have health problems, things like that. Losing a job from an environmental regulation can therefore have costs that are not things that we can brush under the rug. Which is why I think this comes up after we've just had, you know, during one of the greatest recessions since the Great Depression. It's natural then that we would worry about job loss from regulation in that situation. The other side of it, though, is that when you're in a frictionless economy, which there really is no frictionless economy, but when people get jobs quickly, then you lose a job doing something because of a regulation, you're basically just helping another company find a worker who they're desperately trying to find anyway. Because that person's going to end up somewhere else relatively quickly, small adjustment costs, and work their way in. So the answer about jobs is basically, what does the macroeconomy look like? And if you're in a world where the macroeconomy is really bad, the job question is valid. Now, EPA doesn't put jobs into costs and benefits. What they do is they have an appendix at the end of the evaluation of a rule where they look at the job effects. They also have an appendix to look at small business effects. They have a section to look at environmental justice. So that's how they treat it, not as part of the because in pure calculations, a job is a cost. If you want to have a rule that's going to require you hire people to do something, that's a cost. Whereas some people view it as a benefit because people get jobs because of the rule, right? It's funny.
I think we should move to the break here at this point, which is a half hour. And we know, of course, from experience that many of you are going to want to chat with your friends. But the point of this break is for you to have a chance, one of a couple of chances, to look at the posters, which are in a room right behind me. And we'll reconvene here at 11:20 for the last of the plenary talks. Chris, thanks.